I'm at the Ear, Nose, and Throat Center with Dr. Eric Slattery, a board-certified otolaryngologist and a board-certified neuro-otologist. And today, we're going to answer some very important questions about cochlear implants.
Well, thanks, Michelle, for coming. Really appreciate it, and really looking forward to talk about cochlear implants, which is something that I'm very passionate about.
Good. You've been doing it, I understand, for about 10 years?
Yeah, somewhere around 10 years, either with my training or outside of my training. That's correct. So I've had a fair amount of experience with cochlear implants.
Patients of all ages.
That's correct, yeah. Yep, children, adults.
Excellent.
All
So
ages.
who better to tell us about it?
Yeah.
So let's start out with, what is a cochlear implant
Sure.
exactly?
Yeah, so cochlear implant is a device that is meant to bypass the machinery of the inner ear. And so basically the way that it works is it's an electrode basically that goes into the cochlea, which is a part of the inner ear. That's the hearing part of the inner ear. And it directly stimulates the nerve of hearing. So often in patients with hearing loss, there is dysfunction that's happening at the level of the cochlea. And so we're now bypassing some of that dysfunction and directly sending the signal into the nerve of hearing, which then sends the signal to the brain. It is a device that typically is used for patients who have what's called a sensory neural hearing loss. It's a type of hearing loss. It's the most common type of hearing loss that most patients have. And it typically is used in cases where standard hearing aids are not helpful.
So who benefits most from a cochlear implant?
Yeah, so like I was saying, it's usually very helpful for patients who have very limited benefit from their hearing aids. And so there is a evaluation, a cochlear implant evaluation that's done. And that differs for adults and kids. For adults, typically it's done with patients wearing hearing aids. They listen to sentences that are presented to them with their hearing aids in place, and then they have to repeat the sentences back, and depending on their scores, they may then be a candidate for a cochlear implant. For children, especially very young children who have yet to develop speech, say in the 1 to 2 year range, it's a different protocol. It usually is done with a pediatric audiologist who is working with the child, and there are objective tests that are done, such as something called an ABR or a OAE, which allows for us to actually look at the pathway of the auditory system to see how it's functioning, and if there is a lot of hearing loss that's detected there, then they go through a period of time, usually a short period of time, but with hearing aids, and we see if they're progressing as we would expect, and if they're not, then they become cochlear implant candidates.
And so you've, I mean, patients as old as 90 years old can have a cochlear implant?
Certainly, yeah. So the age is not a limit. It is a surgery, so physical condition potentially may be a limit, but age itself is not a restriction.
Okay. And I'm sure you've seen people benefit of all ages from
certainly, yes.
From the cochlear
Definitely,
implants.
yeah. I've seen patients in their 90s and below the age of 1 do very well with cochlear implants.
How fun watching a baby
Yeah,
hear.
it is.
That is amazing.
Yeah.
That would be amazing.
Yeah.
So what's the surgery like?
So the surgery is outpatient, which means the patient would be able to go home the same day the vast majority of the time. In some instances, a patient may stay the night. It is general anesthesia, which means that they will be put to sleep completely. They won't remember anything, won't feel anything during the surgery. And it's usually approximately 2 to 3 hour procedure that it takes to do one cochlear implant. Afterwards, they will have stitches behind their ear, and those stitches typically would come out within 1 week. There's usually a head wrap that's placed after the surgery around the head, and that's taken off usually the next day. As far as care immediately after the surgery, there's not a lot of care that's needed. There will be a little bit of pain, and that pain typically is controlled very well with pain medication. The stitches, like I said, come out within 1 to 2 weeks, and then the actual implant is turned on approximately 4 weeks afterwards.
Oh.
Yeah, so there's two components to a cochlear implant. There's the internal part, so deep to the skin, which is put in during the operation. And that part of the cochlear implant actually has the little electrode that goes into the cochlea. And then there's an external part that would be worn by the patient. That looks very similar to maybe a large hearing aid that the patient would wear behind the ear or even sometimes off the ear. But there's a communication from the external part to the internal part through a magnet and with a coil system. And so that allows for the sound to be brought into the external part. The processing then happens, and then it is transmitted, that signal, into the internal portion, and then that internal portion sends the signal to the nerve, then to the brain. That external part usually is not placed until at least a few weeks after the wound has healed, the incision has healed from the surgery, and then at that point it can be turned on.
So at that point, I'm assuming that's when you begin aftercare. So you work with I'm assuming, to
Sure.
make sure that the wound is okay, and then you're also working with.
So yeah, I typically would see a patient back roughly a week to 2 weeks after the surgery just to make sure the incision is healing, take out the stitches, make sure there's not any other issues going on after the surgery. And then I would see them back approximately a month after the surgery. At that point, typically we would then have it turned on. That's turned on by an audiologist. So the cochlear implant team consists of both the surgeon but also the audiologist, who plays a very large role with the activation, the programming, which we call mapping. And there are usually several different meetings with the audiologist to go over the mapping or the programming. So it's very similar to, say, a hearing aid, that every person has to have their hearing aid programmed individually for each patient to get the maximal benefit from the hearing aid. The cochlear implant is very similar to that, where you have to have the various levels programmed or mapped. And each patient's a little bit different. Some patients may only need 1 or 2 mapping sessions initially afterwards. Others may need more. But those mapping sessions would then happen with the audiologist.
Once those mapping sessions have been completed and they've got you all set, I guess.
Sure.
After that, years later, is there more stuff, or what's that?
Good
look
question.
like?
So typically, no, there may need to be some periodic tweaking of the mapping or changing of the program. And so once a program or a patient has been mapped, it usually is stable for a long duration. But everyone, again, is different, and that can change. And so with time, the processor and the cochlear implant itself may need to be changed. So that's individual, but in general, there is not much long-term reprogramming that's needed once it has been set in a successful way for a patient.
Excellent.
Yeah.
Can someone, if someone is completely deaf and or even just partially deaf in 2 ears, can they get 2?
Sure, patients can have 2 cochlear implants, and so there are potential reasons why you may or may not want to do a cochlear implant in both ears. They're often in somebody who's older, who has had normal hearing and has gradually lost it, or has lost it with time, and hearing aids are no longer useful. What we will do is potentially do the worst hearing ear first. Although not always, and every patient is individual, clearly, and there's individual factors that may play a role. But in general, usually the worst hearing ear is implanted first. And then with time, we wait to see how they do with that first implant. And if they very much like it and they're excited by the benefits that they're getting from the cochlear implant, they potentially could have a second one done in a sequential way. Sometimes cochlear implants are put in at the same time simultaneously. An example of that may be a child who is younger, and you're trying to avoid the anesthetic, having anesthesia more than once, or in cases of, say, somebody who's had meningitis, often you're trying to get the cochlear implants in during a certain time period in order to maximize the functionality of it. And so there are cases definitely where the cochlear implant is placed simultaneously.
So are hearing aids needed after, like, if I've got the cochlear implants, is my hearing aid now, or do I need?
Great question. So there's been a lot of work in the last 15 to 20 years in which it's been shown that the natural hearing that you have, if you still have residual hearing before the cochlear implant, can sometimes be preserved even after the cochlear implant's been placed. We used to think, 15, 20, 30 years ago that once a cochlear implant was placed, that if there was any residual hearing, that would be lost with the cochlear implant, and that you would then be depending completely on the cochlear implant's functionality. What we now know is that with certain electrodes, certain techniques, surgical techniques, that there is the possibility potentially to preserve hearing, and although that's not always guaranteed, in many cases we are able to do that. In cases that do have preservation of hearing after the cochlear implant's been placed, they can benefit from both what we would say acoustic, that's the natural hearing, and the electric hearing. So in that situation you have both an acoustic and electric processor, and so they're basically wearing a hearing aid in that ear, and they're getting the benefit from the hearing aid, and they're also getting the cochlear implant benefit, and that can be helpful in some cases for sure.
Is it like super hearing at that point?
Well, generally if a patient does have hearing that is preserved and they're able to utilize the acoustic or the natural hearing with a hearing aid, they tend to do better. That is correct long term.
Excellent.
They can also wear a hearing aid on the opposite ear still, and in many patients that is the optimal hearing strategy. And so, especially if you only have one cochlear implant, and so we highly encourage patients with some residual hearing in the opposite side ear to continue wearing their hearing aid, and studies have shown that most of those patients in that situation are able to do better than, say, just wearing the cochlear implant by itself.
Excellent. And one thing that I have heard is that it is being covered by insurance.
Oh, certainly, yes.
That's fantastic.
Yes, insurance does often pay for this, third-party insurance as well as Medicare, and in some instances Medicaid will cover for cochlear implants. There's criteria that has to be met. It's based on, a lot of different both medical and audiologic or hearing criteria, but for sure the vast majority of patients who are being implanted in this country are having it done with insurance helping them.
That's fantastic. Well, thank you so much.
Yeah.
And I'm so glad you're here to do this kind of stuff for us.
Well, it's a pleasure, and it's one of the things that I find very rewarding in my occupation. So it's great to be able to do it.
Excellent. Thank you.
Yes, you're welcome.
All right. Thanks.